Dear friends, dear colleague, welcome back to the Essential of Digital Dentistry, this series of 40 videos produced by the Mangano Digital Academy with the support of Kerstin Dental and SMOP. In this video number 7 of the last series, the Done series, we talk about clinical application and we talk about artificial intelligence. Again, it's a very valuable and novel tool for dental practitioner and digital dentists all around the world. It is a very important tool, reliable, and it can be absolutely valuable for our workflow because it speeds up everything and it allows us to work smoothly and in a better and controlled way. Let's talk a little bit about digital dentistry. Let's introduce it. We have a scan phase with the data acquisition from real to virtual. Then we collect during this phase information about bone with beam computed tomography, about the soft tissues and the teeth with the intraoral scanner, about face with the face scanner, and also we can capture the motion of the mandible with digital condylography machine like Mojo, for example. We have talked about it in a previous video. After we have all this set of files, then we can elaborate our plan. But why not to introduce an artificial intelligence software here between these two phases? Because with artificial intelligence, we can merge all the 3D data that we have acquired in a very fast, easy, predictable, and smart way. And then we can use this data already aligned for our planning, and then for the production of what we need to produce. With milling unit, 3D printer, SLS, SLM machine, we can produce several things. Restoration in prosthodontics, we can print surgical guide in surgery, we can print implants as well, we can mill customized scaffold for bone regeneration, we can print meshes for guided bone regeneration, customized as well. Several options. We can print or mill orthodontic devices. Everything we can later, on a later stage, apply clinically and deliver to the patient, and this is the clinical application. Let's talk a little bit about artificial intelligence, a totally new field in dentistry, a very fascinating field. You can read very interesting article from the group of Professor Renilde Jacobs, published in the journal I have the honor to edit, the Journal of Dentistry by Elsevier. And we are talking exactly about the same product, a software that is called ReLu with the virtual patient creator, a very valuable tool to create a virtual patient and to merge all the information of the patient within a single project for our planning purposes. How does it work? It's a very easy case. Let's start with the beam computed tomography, CS9600. In this patient, we wanted to plan implant to restore the posterior mandible, left and right side. Still, we did not treat this patient, but we will, and we wanted to have a complete set of planning. We start from the computer acquisition, and we start from the CBCT as usual, and not only CBCT. Obviously it's an important tool for the evaluation of pre-evaluation of the quantity and the quality of bone, and eventually the available bone, the thickness, the volume, the height, but this is only a preliminary evaluation. Then we go to the guided surgery itself. But what I want to say is, let's go on and let's take an intraoral scan of the dentulous arch, in this case master model, antagonist, and the bite if possible with the CS3800, and then stop. We don't go to the plan immediately as usual. We use artificial intelligence. How to use it? With the virtual patient creator by ReLu. It's an application that we can easily find in the World Wide Web, in the internet, and we can create our own patient and upload our data from beam computed tomography. In this video everything is a little bit faster than it is, but it's a good representation of the whole process. We create our folder, and then we need to upload also the intraoral scan, so the maxilla and the mandible. So we need to upload the beam computed tomography and the intraoral scans. After a few minutes, usually after the file has been uploaded, the segmentation and the alignment of the file, the merging of the file takes takes place, and easily we can find our project fully segmented in a very precise, predictable, reliable way. It's super fast, and we have all the different files as individual STL. And the very nice thing is that these teeth are a combination in real of a segmentation of the root given by the cone-beam computed tomography, but the crown doesn't come from the cone-beam computed tomography. The crown is the superimposition of the intraoral scan in order to have the best possible accuracy. So we can also correct eventually any kind of error occurring during the automatic segmentation, but usually there are no error, no mistakes, and some little correction can be made like in this case, but the point is that the software is extremely reliable itself. We need to remember not to upload too heavy file. For example, in the case of cone-beam computed tomography, it's better to export in a light format and disable some function like, for example, metal artifact reduction or this kind of algorithm that create very heavy file, because the set of DICOM should be less than 1 GB if possible. 500 megabyte would be the best, and then we can proceed. There are also, this adaptation can be done manually to increase the quality of the merging, but after all we have a series of STL files totally independent we can play with. We can extract, for example, this tooth, this teeth we can extract, but we don't want to. We just want to implant in the posterior mandible, and here we have the button for downloading all the STL file. This application is very cheap. You have a series of free cases at the beginning when you register, and then you pay a little bit when you download the STL file. Considering the quality of the segmentation, considering the speed of the process, considering the reliability of the model coming from, I think it's a super application that I strongly suggest. Exactly like DiagnoCut, this application is incredible because it allows us to save a lot of time to obtain predictable model to work with in a series of, possible planning or application. For example, we could plan eventually post-extraction implants in the case we want to extract this implant, but it's not the case. But look at how the model after the extraction is reliable. It's beautiful to see, and we can extract the tooth, we can isolate the mandibular nerve, we can play with the file totally free, and all files available separately as free STL for the download. And the very nice thing, as I mentioned you, is that there's a fusion between the cone-beam computed tomography and the intraoral scan, because the crowns, after all, in this model come from the intraoral scan, so it's very accurate, but the root comes from the CBCT, and everything is merged perfectly in order to give a model that is reliable. How to use this model? There are several potential innovations. I just want to mention one we are working with. We are preparing some research. We use augmented reality with HoloLens 2 from the Microsoft company, and HoloDentist, that is a proprietary software from the company 15 Genium, located in Milan. This is a beautiful tool, augmented reality, to communicate between colleagues, to communicate with the dental technician, because we can see 3D model of our patient gigantic in the middle of the room, and we can discuss eventually treatment, procedure, protocol. Also, we can explain to the patient what kind of treatment we are planning to do with them, and that will help, of course, to have an increase of the number of the compliance of the patient at least, and the patient can accept the therapy easily because it's very visual and very immediate and very fascinating. But in this case we did something different. We are doing something different since a few cases. We are trying to plan our surgeries using only STL file and using only artificial intelligence, like in the case I mentioned here, by Relo, plus augmented reality, the software HoloDentist. So the idea is to skip all the possible steps of the planning in a guided surgery software, but to use free STL and augmented reality and all dentists to plan everything. This is what we did, and it works perfectly. So it is an idea we are developing, and we are preparing a publication because we made some cases. Obviously it is necessary now to check everything, going back and saving back all the position in a computer-assisted design software like Mimix or any other software. But the point is, in the future we'll be able to skip the 2D planning, working straightforward with a 3D protocol, including and using artificial intelligence and augmented reality together, and it will be fast and predictable and very smooth, and we will save a lot of time, and will be also funny because planning in 3D with augmented reality is fantastic. So thank you very much for your kind attention.